raised its global pandemic alert to level 5, its second highest level. That means a pandemic is imminent and all countries must finalize preparations to deal with the outbreak of swine flu. Also today, the BC Centre for Disease Control said that 3 more cases of swine flu have been confirmed in this province. And a BC medical officer has now raised another issue. Pandemics last much longer than most public health emergencies and often include waves of influenza activity, all of which could have an impact on the 2010 Games.
With 9 months to go until the Olympic Games begin, health officials are warning the timing may be disastrous. BC could be in the midst of an influenza pandemic come February 2010, just in time for the world to land on our doorstep.
One scenario could be that if this does go pandemic, that it could affect the Vancouver Olympics.
What's unclear is whether or not we're currently riding the first wave of the swine flu. If that's the case, health officials say it has the potential to come back in the fall and then hit hard in a third wave during the Games.
The implications of this for the Olympics, I wouldn't want to talk about. I think it's early days yet. There's plenty that we can do to mitigate the situation.
It may be too early to tell, but those in the travel industry say even the possibility of an epidemic could keep Olympic tourists away.
This impact is going to be really hard on the travel industry in general. We saw after SARS that people stopped traveling.
The pandemic level has been raised through several stages, originally affecting animals only. Today, the World Health Organization raised the level from 4 to 5, as it is now being transmitted from human to human and is showing up in at least 2 countries.
Influenza viruses are notorious for their rapid mutation and unpredictable behavior.
Word of the first swine flu-related death in the U.S. came this morning. A toddler whose family was visiting from Mexico City passed away in Texas.
We do not think this case should trigger any undue alarm in our community.
In Mexico, the death toll did not jump significantly for the first time in days. It stands at 159. And here at home, 3 new cases have been confirmed on the Lower Mainland. 2 of the individuals have just returned from Mexico. The 3rd person got sick by being in contact with a traveler, marking the first person-to-person transmission in BC. Whether or not that kind of transmission is sustained is something health officials say they'll be watching closely.
And if it sometimes seems that the world is overreacting to an illness as common as the flu, one BC expert would tell you that you simply can't be complacent about a possible pandemic. Any new and aggressive virus can become a killer on a mass scale, especially now that the world has become a smaller place.
The year was 1918, and it was the mother of all flu pandemics. The Spanish flu spread to half the world's population. World War I was winding down and no one was traveling. Yet the flu killed an estimated 50 million people in every corner of the world. There was no vaccine, and it was only recently medical scientists actually identified the pandemic virus.
They only isolated the virus in a lab last year. They didn't even know what the virus was for 80 years that caused such devastation.
Only last year?
Yeah, only last year. They had to dig up out of bodies out of the permafrost and recreate and genetically re-engineer the virus. They never had it. It just disappeared.
Dr. Kella should know. He's a novelist who writes medical thrillers. He's had half a dozen bestsellers, including Pandemic, which has been translated into 10 languages. His books, in addition to being dramas, are life lessons about fear and worldwide threats of a killer virus.
The reason we don't normally every year have pandemics is because most flu viruses that emerge from year to year are just slight variations on the ones that happened the year before. When real problems happen is when you get these what's called antigenic shifts, where they have a brand new virus that our immune system has never seen before and is devastating to us. And theoretically, that's what happened with Spanish flu, and theoretically that could happen again.
The ribs is perfectly fine.
The novelist in his other life is an emergency physician at St. Paul's Hospital, a frontline soldier on the medical side of sickness, a doctor with credentials to write about flus and pandemics. During the SARS outbreak 6 years ago, he was on a Canadian task force thwarting the spread of the virus. He says we can never let our guard down because the law of averages has another pandemic in our future.
I think we've learned first and foremost that they're inevitable. You know, as long as they've had good historical records, we found that these cyclical pandemics happen. In fact, we're very arguably overdue for the next pandemic. It's been 40 years since the last one, and as I said, it was a very mild one when we had it. So it's kind of like the earthquake theory. You know it's coming, you just have to be prepared for it.
The lessons in Dr. Kella's novels never overestimate the potential of a new influenza, and we can never be over-prepared for an onslaught of an aggressive virus, because like the Spanish flu, the outcome can be disastrous.